Okay, good morning, student, once again. How are you all?
Fine, ma'am.
Okay, today we will be starting with the new chapters, okay? Means the new unit we will be studying today. And whoever notes that I haven't checked that day, all those, if I have time, then if time is left, then I will be checking at the end of the class if there is a remaining time. And I told you all to write down this tumor of kidney also. Now, if I have time, then I will check today. If there is less amount of time, then I will check tomorrow. Okay, let us first discuss about the today topic. Is the screen visible?
Yes,
Is the
ma'am.
screen okay? Okay, today we will be discussing about the obstructive uropathies. Have you ever heard the term obstructive uropathy? Have you ever had the term obstructive uropathy? कभी सुना? Obstructive uropathies के बारे में कभी सुना?
नहीं, ma'am.
Okay. So today we will be discussing about this. First, let us see the definition of obstructive uropathies. Obstructive uropathy is when the urine can't or cannot flow, either partially or completely, through ureter, bladder, or urethra due to some types of obstruction. Instead of flowing from the kidney to the bladder, the urine instead will flow backward or reflux into kidney. तो obstructive uropathy का मतलब क्या है? This obstructive uropathy means it is when the urine, it cannot flow the urine cannot flow completely or else like partially through the ureter or else the bladder or the urethra. Why it cannot flow completely or partially? Why it happened like this? Because this happened due to the obstruction that occurs. So instead of flowing our urine from the kidney to the bladder, it will flow backward or reflux back into the kidney. This is known as obstructive uropathy. You understand what is obstructive uropathy? Do you understand or not? Or else I'll explain again. You understand?
Yes.
You understand?
Ma'am,
No,
explain
ma'am.
again.
I'll explain again.
Yes,
Yes,
ma'am.
ma'am.
ओके ऑब्स्ट्रक्टिव यूरोपैथी का मतलब है ना, जब हम नॉर्मली यूरिन पास करते हैं, लेकिन अगर कुछ ऑब्स्ट्रक्शन है, कुछ ब्लॉकेज है, तो क्या होता है कि अगर हमारा यूरेटर में कुछ ब्लॉकेज है, हमारा ब्लैडर में कुछ ऑब्स्ट्रक्शन है, ऑब्स्ट्रक्शन माने कुछ ब्लॉकेज जो ब्लॉक करता है, इट माइट बी अ स्टोन और व्हाटएवर, तो क्या है कि हमारा जो नॉर्मल यूरिन फ्लो है वो नॉर्मली फ्लो नहीं होता, कंप्लीटली फ्लो नहीं होता, या फिर थोड़ा थोड़ा पार्शियली मींस थोड़ा थोड़ा फ्लो होता है. ऐसा क्यों होता है? क्योंकि हमारा यूरेटर या फिर ब्लैडर या फिर यूरेथ्रा में कुछ ऑब्स्ट्रक्शन है, कुछ ब्लॉकेज है, तो उसका वजह से यूरिन अच्छी तरह फ्लो नहीं होता. एंड दैट पार्टिकुलर प्रोसेस is known as obstructive uropathy. समझ में आया? समझ में आया?
Yes, ma'am.
Srijana, you understand what is obstructive uropathy?
Yes, ma'am.
Samuel, can you please explain what is obstructive uropathy? Samuel.
Yes, ma'am.
Yes, explain. देख के explain करो, देख तुम्हारे हिसाब से according to your understanding explain करो, जो भी language में चलेगा, you just explain.
जब हम लोग का यूरिन फ्लो नहीं कर
Ureter.
पाता है बिकॉज ऑफ सम ऑब्स्ट्रक्शन, हम लोग का यूरेटर, ब्लैडर और यूरेथ्रा में जब होता है किडनी में उल्टा फ्लो बैक करने से उसको obstruction
ऑब्स्ट्रक्टिव यूरोपैथी बोलते हैं। तो
uropathy.
हमारा नॉर्मली फ्लोइंग यूरिन कैसे फ्लो होता है, किडनी से लेके किडनी टू ब्लैडर, इज इन इट। लेकिन ऑब्स्ट्रक्टिव
ma'am.
यूरोपैथी में क्या होता है, इंस्टेड ऑफ फ्लोइंग फ्रॉम द किडनी टू द ब्लैडर, द यूरिन इंस्टेड विल फ्लो बैकवर्ड और रिफ्लक्सेस बैक इनटू द किडनी। किडनी से ब्लैडर जाना था, लेकिन वो ब्लॉकेज का वजह से किडनी से ब्लैडर नहीं जाएगा, इंस्टेड जो ब्लैडर में जाने वाला था वापस किडनी में चला जाएगा फिर से। That process is
Yes,
known as
ma'am.
obstructive uropathy. All of you understand? All
Yes,
of you?
ma'am.
Okay, let us move on.
Ma'am.
This is not that much clear. It means like it's just the causes, like the main causes I will be explaining after this. I'm just showing the picture. It's not that clear. Actually, I have downloaded from the net. That's why it's not that clear. Causes of obstructive uropathy. क्या क्या का वजह से obstructive uropathy, ये जो blockage obstruction होता है, because of our enlarged prostate, because of kidney stone, all these I will discuss afterwards. I'm just showing this is because of if जो prostate है अगर enlarged हुआ, या फिर ये kidney हमारा normal kidney के पे अभी ये सब stone, if there is a stone in the kidney, or if there is a urethral stricture, this is the diagram, and if there is a uterine cancer, agar uterine में अगर cancer हुआ, so all these things are the causes of obstructive uropathy. I'm just showing this a few diagrams. Next, we will discuss about this. Let us discuss the common causes of obstructive uropathy. So क्या का वजह से ये obstructive uropathy होता है? Let us see. First is अगर हमारा bladder में stone हुआ तो obstructive uropathy हो सकता है. If there is a stone in our bladder, understand? Yes or no? Understand?
Yes,
yes. Okay. Next, किडनी में अगर स्टोन हुआ तो किडनी में स्टोन होने से भी ये obstructive uropathy हो सकता है. And then next, if there is a benign prostatic hyperplasia, माने enlarged prostate, which I have already shown to you in the previous diagram. And next is bladder or uteral cancer. Bladder या फिर ureter में अगर cancer हुआ तो there is a chances of obstructive uropathy. Then अगर cervical cancer, अगर cervix में cancer हुआ, all this का वजह से ये obstructive uropathy हो सकता है. Next, uterine में cancer हुआ, so after that, if there is any problem with the nerve that supply the bladder, but there are so many nerves, isn't it, that supply the bladder, तो उस nerve में अगर problem हुआ तो there can be obstructive uropathy. These are the common that I have just given to you. So you can just by heart all this. क्या क्या का वजह से obstructive uropathy हो सकता है? So all these common one you can just by heart. You know, there is a colon cancer. Colon means like वो जो intestine का जो part. तो वो bladder stone हो सकता है. Common bladder stone, kidney stone, cervical cancer, uterine cancer, ये सब. These are some of the causes of obstructive uropathy. Please like listen carefully, okay? I will ask at the end of the class, I will ask all those things. Many art point dia. Okay, let us move on. For now, let us discuss about the symptoms of obstructive uropathy. So obstructive uropathy का मतलब तो तुम लोगों को, you already know the meaning of obstructive uropathy. That means there might be obstruction in the ureter, in the bladder, in the kidney, in all those there will be obstruction. It's not it because of that the urine was supposed to flow from the kidney to the bladder, but it won't flow. Instead, it will reflect back. That was the definition. So taking means like keeping that definition in mind. What symptoms? First of all, what symptoms comes in your mind? First of all, symptoms क्या होगा? According to you, already पता चल गया कि उसमें obstruction होगा. तो urine में क्या हो सकता है? तो can anyone tell me? इसका symptoms क्या हो सकता है? Polyuria होगा या फिर oliguria होगा या फिर क्या हो सकता है?
Dysuria.
Yes, dysuria. Very good. Dysuria. Dysuria का मतलब क्या था? Ilasara, dysuria. Ilasara, dysuria.
It is a Pain while passing urine.
Yes, yes, pain while
Pain.
passing urine. It's not it because very good. That answer was very nice. Dysuria. This is very important. And this is the most common. While urinating, you will feel pain because obviously there is something na stone bhi ho sakta hai, obstruction ho sakta hai. So obviously pain feel hoga. So now my question again is polyuria hoga ya fir oliguria hoga? पोलिग्यूरिया होगा या ओलिग्यूरिया होगा? यूरिन ज्यादा होगा, यूरिन जो यूरिनेट कर रहा है ना, एक्सक्रीट कर रहा है, वो the amount of urine that you excrete will be more or less? Will be more or less?
Ma'am, less.
Less, isn't it? Because there is obstruction, so there will be less amount of urine. तो क्या होगा? पोलियूरिया होगा या ओलिग्यूरिया होगा? See the answer.
Olivia.
Yes, ओलिग्यूरिया होगा. तो शीतल ओलिग्यूरिया क्या था?
Ma'am, urine pass more less than 400
Yes,
ml per
400 ml per day, isn't it? तो यूरिन का जो यूरिन पास करोगी वो amount of urine you excrete out that will be less because there will be blockage. So that, and what about that? Can there be like infection? Can there be infection? The symptoms. अगर obstructive uropathy हुआ तो infection हो सकता है? Anyone? If it is wrong or right, you just say the answer, no problem. Can there be infection? Infection हो सकता है? Anyone? Anyone?
Yes, ma'am.
Yes, yes, say. Okay, Samuel, can there be infection?
Yes, ma'am.
Yes. Okay, then, okay, very good. There can be infection, it's not it. Okay, then who will tell me the answer? Shirley, if there is infection, what can occur? अगर infection हुआ तो क्या हो सकता है? Srijana, infection हुआ तो क्या हो सकता है? If there is infection, you can have? Any idea? Any idea?
No,
Okay, what about you? Have you had the time
Cancer.
fever? Fever, have you had the time fever? Fever. Have you had the time
Yes,
fever?
ma'am.
Yes, if there is something infection, okay, then that can lead to fever. So this will be the, in obstructive uropathy, there can be infection, and understand, and this infection led to fever. So always remember, in any disease, not only about this obstructive uropathy, in any disease, understand, if there is infection occurs, understand, in any part of your body, then there is a great chances of developing fever. So fever, the sign of fever is always the infection. Just remember that. Then what else can you find? What else can be the sign of symptoms of obstructive uropathy? Can there be a blood in urine? Can there be a blood in urine? Obstruction will be there. The infection also will be there. Then can there be a blood in urine? Yes or no?
Yes, ma'am.
Okay, very good.
Yes.
Okay, there can be a blood in urine. So Sheetal, blood in urine is known as what? Sheetal.
hematuria.
Yes, very good. Okay, let us discuss now. That was just like, I want to like get some idea from you all that whether you really understand the meaning of obstructive uropathy or not. So first is blood in urine, that is hematuria. So if a person have obstructive uropathy, then you will get a sign of blood in his urine. So next is, you will find decreased urine output, which we already discussed. In short, in medical term, we write decreased urine output as oliguria. So it's very common. Next is feeling as if the bladder is never empty. Means this kind of feeling also you will have, understand? You will feel as if you will pass the urine, okay? You will pass the less amount of urine. And then you will always have the feeling as if your bladder is never empty. Even after the passing the urine, you will always have the feeling of this. This is the third point. Next point is fever. Fever was because of infection. Next is frequent urination, this very common. Next, nausea and vomiting. Nausea and vomiting is also very common. And then next is flank pain. Flank pain तो मैंने already पहले बोल दिया था. Srijana, what was flank pain? I have already discussed in my last class. Flank pain.
Pain in the back.
Pain in the back and pain in the back, isn't it? Okay, okay. Who else want to explain? Marcy, can you please explain what is flank pain? What Srijana said is correct. Still, flank pain. Flank pain. Flank pain, you can also simply say, like, it is the pain in one side of the body that is like between your abdomen and your back and your backside. That is when that kind of pain occur. If the pain occur like between your abdomen as well as your back, and in that case you can say that, oh, there is a flank pain occur. That is the meaning. And then you will get edema. I have just written down like this: swelling of hand, feet, arms and legs. But in exam you can just write edema. Edema का मतलब क्या है? Means like accumulation of fluid in our body, isn't it? तो हमारा शरीर फूल जाता है, तो उसको बोलते हैं हम edema. तो उसको मैंने ऐसे ही mention किया: swelling of the hands, swelling of the feet, swelling of the arms, swelling of the legs. You can write all these things also. But in short, if you simply write edema also, I'll give full mark. So this is the 8 point. And the next is weak or slow urine stream. जो urine pass करोगी ना, that will be in a very slow stream. Like it won't pass. You won't pass the urine smoothly. Like the urine that you pass, the urine stream that you pass, it will be weak or else it will be very slow. These are the symptoms you will get if a person, if he or she suffer from obstructive uropathy. So next is dysuria. That was like dysuria, which we already discussed. These are the points that these are the 10 points for the 10 points of the sign and symptoms of obstructive uropathy. Do you have any doubts from this 10 point? Anyone? Anyone? You have any doubts? Get ready to answer all this. Now it's my duty to explain, and at the end of the class it's your duty to like give me the answer. So any question, any point, number 1, number 2, 3, 4, 5, 6, 7, 8, 9, 10. Is there any point that you don't understand and you want me to explain? Is there any point? Anyone? Student? Anyone? Anyone? Anyone?
No.
Okay. Shall I move on?
Yes, sir.
Okay. Next is the diagnostic evaluation, which is very, very interesting. So agar, like, again, let me guess your idea. So there is an obstruction. There is obstruction, okay? Like there is obstruction, and then what diagnostic evaluation can you do in order to diagnose that, whether like kidney stone or bladder stone or anything, any obstruction present? If any obstruction is present, how can you diagnose that? Will you do ultrasound? Will you do ultrasound?
Yes, ma'am.
Ultrasound. तो हम ultrasound क्यों करते हैं? Anyone have any idea? Okay, no problem. Ultrasound means like, this is like an imaging test, okay, that uses the sound wave. Sound waves use karta hai in order to create a picture of any organs or tissues or any other structure that is present inside the body. So that is known as ultrasound. Or kuch idea hai? Any test? First, catheterization, diagnostic evaluation. Catheterization may be done immediately after voiding to determine the amount of residual urine in the bladder. So like how, read the number 1 point nicely. तुम लोगों को ये कैथेटराइजेशन लास्ट टाइम पे भी मैंने दिया था. Do you know the meaning of this catheterization? कभी सुना कैथेटराइजेशन? लाइफ में देखा?
Yes, ma'am.
Okay, okay.
Yes, ma'am.
Okay. Catheterization may be done immediately after voiding, means after passing the urine. So catheterization क्यों immediately like क्यों catheter लगाता है? Catheterization क्यों perform करता है after urine pass, immediately after passing the urine? Why do this? In order to determine the amount of residual urine in the bladder. This is the first point. Okay, let us come to the next. Next is intravenous urography. Intravenous urography is used to intravenous urography ये एक like ये एक test का नाम है. It is used to visualize urinary tract and to measure renal excretory function. And the next is cystoscopic examination. Cystoscopic examination भी करता है in order to diagnose these obstructive uropathies. And then again, next is urine culture, and the next one is the blood test. These are the few diagnostic evaluation that is done in order to diagnose the presence of these obstructive uropathies. Okay, coming to the next. Next is like few of the management. First of all, the management is done through surgical correction, because if the stone is present, it's not it whether in your bladder, in your ureter, or else in your kidney. If the stone is present, then obviously the best process and the primary process of treatment that is mainly performed is surgery. Surgery करके वो obstruction को remove करता है. So that is the first management that you can perform. And next, the name of that surgery is also known as nephrostomy, and the other one is lithotripsy, and the other one is urinary catheterization. So catheter laga ke already we discussed there, and the other one is ultrasound, and the other one is like any kind of like infections is controlled through antibiotics. Means like if a infection occurs now, then you can give the antibiotic in order to correct this infection. And these are the like management. I have given only a few management because much management is not required for these uropathies. Just the surgery, as well as if there is any infection, you can just give these antibiotics. Do you know what is nephrostomy? Do you have any idea what is nephrostomy? Nephrostomy? Anyone? Nephrostomy?
No, ma'am.
Okay.
This nephrostomy how to say, like nephrostomy, it isn't like artificial, okay, like not the permanent. It is just like it is an artificial opening, okay. Artificial opening is created between the kidney and the skin, which will allow for the urinary diversion directly from this upper part of the urinary system. So ऐसा करता है. तो nephrostomy, like you can just write down nephrostomy. It is an artificial opening which is created between the kidney and the skin. So between the kidney and the skin, kidney और skin का बीच में ना वो है एक opening create किया जाता है. Like just an artificial opening is created between the kidney and the skin, and this will allow for the urinary diversion directly from the upper part of the urinary system. So that is known as nephrostomy. So whatever I have mentioned, you can just write it down. Lithotripsy. You have any idea about lithotripsy? Lithotripsy.
No, ma'am.
You have, or you never heard this? Means मैं simple से बोलती हूँ हाँ. Lithotripsy, it is what to say, जो lithotripsy, like एक एक मेडिकल का प्रोसीड्योर है, हाँ, they will use some shock waves, okay, or a laser ये एक शॉक वेव्स यूज करेगा या फिर एक लेजर यूज करेगा in order to break down the stones in the kidney, गोल ब्लाडर और यूरेथा। अगर ना किडनी में स्टोन है और गोल ब्लाडर में भी स्टोन है या फिर यूरेथा में कहीं पे भी जहां पे भी स्टोन थे that cause obstruction, हाँ, वो स्टोन को क्या करता है, छोटा छोटा करके ब्रेक किया जाता है। like अगर स्टोन, suppose the stone is 18 millimeter, then they will try to break that stone using this lithotripsy procedure. They will try to break that stone into small pieces. Understand? तो छोटा छोटा करने से तो it will be easy to remove ना, so that is why this lithotripsy method is used. समझ में आया lithotripsy?
Yes,
Yes or
ma'am.
no?
Yes, ma'am.
Okay. Srijana, keep on taking attendance. Huh? Only 10 minutes left. Okay.
Okay, ma'am.
Then
मैम
urinary.
कैथेटराइजेशन का मतलब क्या है?
कैथेटराइजेशन का मतलब है ना, जो लोग जो यूरिन पास नहीं कर सकता है, कैथेटर एक आर्टिकल्स है, हाँ, कैथेटर ये वुमेन का वुमेन और मेल का जो कैथेटर है वो सेम है। तो जब इंसान यूरिन पास नहीं कर सकती, हाँ, जब यूरिन पास नहीं कर सकती, तो ये जो आर्टिकल है ना, ये जो इंस्ट्रूमेंट है ना, उसको हाँ पढ़े, ये उसको अपना जेनाइटल पार्ट में ये घुसाता है ताकि ये यूरिन पास कर सके। थ्रू दिस यूरिनरी कैथेटर वो लोग यूरिन पास करता है। अंडरस्टैंड?
Okay, ma'am.
Yeah, for male they put in their genital part and for female also they put there, तब इसमें ही यूरिन पास किया जाता है। and ultrasound तो you know, and then any kind of infection is controlled। अगर कुछ भी infection होने से antibiotic जो भी like physician या doctor prescribe करेगा वो दिया जाता है to control the infection। So these are some of the management। So as the time is very less, so let us revise whatever we have discussed today। Okay. Okay, let us come back to the definition। Today we have discussed about this definition obstructive uropathy। Let us again revise soon। Obstructive uropathy क्या था? ये जब इंसान normally means like थोड़ा यूरिन पास करता या फिर completely पास नहीं करता। क्यों? क्योंकि यूरेटा या फिर ब्लैडर या फिर यूरेथ्रा में कुछ obstruction है, उसका वजह से normally यूरिन पास नहीं कर सकता। That is known as obstructive uropathy। And then instead of flowing our urine from the kidney to the bladder, it will instead flow, the urine will instead flow back towards the kidney। So that is the definition of obstructive uropathy। और उसके बाद क्या discuss किया था? Causes, and we have discussed about the causes। So like Srijana, tell me please the two causes, any two causes, Srijana, any two causes?
Yes, ma'am. Bladder stone and kidney stone.
Okay, very good. Okay, Finisha, can you please tell me one causes? Only one.
Enlarged prostate.
Pardon?
Oh, no. Bladder or urethral cancer.
Okay. Ishan, can you please tell me one causes? Ishan, can you please tell me one causes? Only one cause? Ishan?
Hello, ma'am.
Yes. Say. Only one cause. Anything. क्या का वजह से ये obstructive uropathy होता है? Ishan. Samuel, help Ishan.
Ma'am, colon cancer,
Pardon? Yes. And then?
cervical cancer.
Yes, I already gave the answer. All these, okay? Don't get confused.
Yes.
Okay, let's go back. Let's go to the symptoms. Samuel, tell me true symptoms. Hurry up. Sheetal, get ready. Samuel, tell me true symptoms. Hurry up.
Ma'am, blood in urine,
Yes, and then?
decreased urine output,
Yes, very good. Okay. Sheetal. Tell me two.
Dysuria and fever.
And fever. Okay. Ilasara, tell me one.
Nausea or vomiting.
Okay. Mercy, tell me. Mercy, tell me two.
Edema,
Yes.
weak and slow urine stream.
Yes, very good. Okay. That means you all understand. Okay. Okay, diagnostic evaluation. In diagnostic evaluation, what was the first point that I gave in diagnostic evaluation? Rudolph, what was the first diagnostic evaluation that I gave? Nafisisa, what was the first diagnostic evaluation that I gave? Nafisisa.
Catheterization.
Yes, catheterization, isn't it? It may be done immediately after urinating. Why? In order to determine the amount of residual urine in the bladder. Next was intravenous urography, cystoscopic examination. All these are very common and I gave very less. This and urine culture is also done. And the last point, what did I give the last point, which was very common? To whom I will ask? I will ask to Surajit. Surajit, can you hear me? Surajit, can you hear
Yes,
me?
ma'am.
Okay, मैंने
Yes,
जो
ma'am.
सबसे last point diagnostic evaluation का कुछ दिया था, कुछ टेस्ट कुछ दिया था, क्या था वो? एक तो कैथेटराइजेशन करते हैं यूरिन पास करने के बाद, और फिर इंट्रावेनस यूरोग्राफी भी करते हैं, सिस्टोस्कोपिक एग्जामिनेशन भी करते हैं, यूरिन कल्चर भी करते हैं। तो लास्ट में जो दिया था मैंने, कुछ टेस्ट दिया था, क्या था? Who will
I
help
forget,
Surajit?
ma'am.
Okay, no problem. Okay, who will help Surajit? Okay, Ishan, tell me, what did I give at last?
Ma'am, ultrasound.
Okay, whom will I ask? Monica, can you please tell me what did I give? Ilasara, tell me.
Blood test.
Yes, very good. Blood test. This is the most common. That's why I just asked. So in whatever disease that occurs, ना कुछ भी disease होने से उसको diagnose करने के लिए या कुछ करने के लिए सबसे पहले जो भी हो, they used to perform this blood test. Blood test is always performed. So remember this: urine culture, blood test, all this. That was the diagnostic evaluation. And then management, discuss kiya tha. Management. First of all, surgery is done. Nephrostomy, I explained. Lithotripsy. Sital, lithotripsy kya tha? Time is going to get over. Sital.
मैम जो किडनी में स्टोन को छोटा-छोटा पीस used to break down.
Yes. Yeah, not only the stone that is present in the kidney, okay? Like the stone might be present in the kidney, it might be present in the gallbladder. Understand? It might be present in
Yes,
the
ma'am.
ureter. कहीं पे भी stone present होने से उसको like the through the sound waves, understand? All these particles are being break down into small pieces. It's correct. Okay. Next, urinary catheterization, which I already explained. And then ultrasound, to sabko pata hai. Ultrasound means like they used to take the like images through the sound wave. They used to take the picture images of any tissues or organs that are present inside our body. So these are this much we discuss for today. We'll be discussing for today. You do you understand today class? आज का class समझ में आया about this
Yes,
obstructive
ma'am.
uropathy? Okay, anyone have any doubts? Time is going to get over.
No, ma'am.
Okay. I will be sending in these notes now, whatever I have given these notes to you all. Today evening I will send, now I won't send. Anyone have any doubts? Anyone? Sabko samajh mein aaya?
No, ma'am.
Okay, Ishan, you understand? Ishan?
Yes, ma'am.
Sleeping. Bishal is absent or what, Bishal? Srijana, is Bishal
No, ma'am.
absent?
No, ma'am.
Okay, you're present. Okay. Okay, then there's only 1 minute. Srijana, are you done with the attendance?
Yes, ma'am.
Or you have any doubts to ask?
No, no, ma'am.
Okay. Thank you, everyone. Enjoy your day.
Thank you, ma'am.
Thank you, ma'am.